Okay, so I have here a 13-year-old patient with spastic cerebral palsy. He is here for a clinical swallow evaluation because people with cerebral palsy are at an increased risk for dysphagia, and his family wants to reevaluate the foods that can be safe for him to consume and want to see if there have been any changes in his swallow function as a result of therapy he's already been receiving. So he does have a history of mild dysphagia in the oral preparatory phase as well as the oral transit phase and in the initiation of the pharyngeal swallow. Since I don't have a partner, you'll see all the behaviors he exhibits and the things I'm noticing in my clinical evaluation in my report, and as I'm just kind of speaking them out loud throughout this. He does have a history of speech and language therapy to address his dysphagia as well as articulation and language goals. So before the exam, I would check his vital signs, mental status, make sure he can follow 1 and 2 step directions, and I am conducting a clinical swallow evaluation to assess his current swallow function to see if we can make any changes in his diet or anything like that. Okay, so first I'm gonna sanitize my hands in preparation for the evaluation, as well as I'm gonna gather all my materials. So I'll have my pen light here, a tongue depressor, my various liquids, food items of varying thicknesses, and I will have put my gloves on as well. Okay, now I'll greet the patient. Hi, my name is Michaela. I am the speech pathologist that's gonna be working with you today, and I'll ask him how he is. How are you? Okay, awesome. So I was talking to your parents and the nurse, and they've told me that you all wanted to come in and see if there's been any changes in your swallow since you started therapy. Does that sound right? Okay, awesome. So before we get started with the evaluation, I'm just gonna kind of take a look at you, and I'm gonna have you do some things for me so I can see how your face sits and moves and see how everything is working before we start. Does that sound good? Okay, awesome. So first I'm gonna have you look straight at me here. So I'll have him look straight at me. Right now I'm gonna be looking for any symmetry in his face, making note of his breathing patterns. Is he breathing out of his mouth? Is he breathing out of his nose? Now I am going to have you bite your jaw together like this. Here I'm assessing for strength of his muscles and his jaw closure to see if he's able to do that. Okay, so now I'm gonna have you open your jaw like this, and I'm gonna put my hand under your chin here, and I want you to try to keep your jaw open, and I'm gonna try to close it. So this is gonna help me assess kind of your jaw strength here. So then we'll do that. I'm applying resistance to try to close his jaw, and he's trying to keep it open. Okay, now I'm gonna have you do the opposite of that. So I want you to close your jaw as much as you can, just like this. I'm gonna put my hand under your jaw again, and I want you to try to open it against the resistance that I am putting on it, like that. We'll go to that and seeing that he's having a little more trouble doing this, not as much strength there. Okay, so now I'm gonna take a look at your tongue. So I'm gonna have you open your mouth. I'm gonna just have you stick out your tongue like this. Here I am looking at his tongue. I'm taking note of color, the tongue size, any uncontrolled movements or fasciculations. Muscle spasms are and can be a symptom of spastic cerebral palsy, so this is definitely something that I would be looking at. So okay, now awesome. I'm gonna have you stick out your tongue, just out like this. Okay, awesome. So here within these next movements I'm gonna have him do, I'm looking at the range of motion of his tongue, the strength, the coordination of the movements all together. So can you put your tongue up here like this? Okay, awesome. And can you move it down here? And up and down. Okay, here I'm taking note of all those things. Now can you move your tongue to the left? And then to the right. Okay, and see if you can do it back and forth. Okay, now we're gonna move on to the lips. So I'm gonna take a look at your lips. First off, can you smile for me? And here when he's smiling, I'm going to be looking at the symmetry of his smile, if there's any drooping, any muscle spasms, anything like that. All right. Now can you stick out your lips for me? Okay, this is the protrusion of the lips. I'm noticing in the strength here. Can he do that? Okay, now I'm gonna have you puff up your cheeks with air for me like this. I want you to hold the air in there. And I'm gonna touch your cheeks and see if there's any air coming out and test kind of the strength there. So here I would be seeing if there's any air coming out of his mouth while he's doing this. Feel for strength, see if there's any air escaping his lips. Okay, now we're gonna move and I'm gonna look into your mouth. So I want you to open your tongue like that. I'm gonna take my tongue depressor and I'm going to look into your mouth here. Here I'm looking at the hard palate, the soft palate, the uvula, the tonsils. I'm seeing if everything's symmetrical, kind of the anatomy of everything. I'm also going to be taking note of his teeth and just the state that those are in. So I'm looking at all of that right now. I'm noticing symmetry in his mouth. Everything's looking pretty good. Now, last thing I'm going to ask you to do before the rest of the evaluation is I just want you to force a cough. I just want to hear how that cough sounds. And he'd cough, and here I'm assessing for how clear it sounds. I'm also kind of just been listening to his vocal quality throughout all of this, just hear if any of it sounds harsh or anything like that. So now, awesome, thank you for going through that with me. We are gonna move on to the next part of the exam, if that sounds good. So before the swallow eval, I would make sure that I have all my materials out, the mouth swab, thin liquids, ice chips, any thickened liquids, and then the foods for our solid trials, which include the puree, the mechanically altered, and then our regular hard solid, and I'd have all of those out. Throughout the process of all of this, I'm going to be looking for any spillage between his lips, his jaw and tongue movements in general, if he has any facial grimace, any signs of aspiration, multiple swallows, choking, gagging, or anything like that. This is just to kind of assess his swallow function and see what foods he can be consuming safely at this point. So yeah, okay, now I'm gonna have you try some different drinks and foods to see how your swallow goes with all of the different kinds. So I'm just gonna start you off with a super thin liquid to start. We're just gonna start off with water. So I'm just gonna have you swallow a little bit of this water. I have some of it on a spoon here first. And then I'd have him take a little sip of the water off of the spoon. Here I'm assessing if any of it's falling out, any choking, gagging, or anything like that. Then I would move on to consuming the water from a cup. So now I'm gonna have you do the same thing with the water, but this time I have a cup for you, and I am gonna have you take some sequential swallows from the cup. And here I'd have him do that and assess for the same thing, see if there's any water falling out, if he's having any trouble gagging or anything like that. Now we're gonna move on to the water, but this time from a straw. So I have a cup of water with a straw, and I'm gonna see how you do with swallowing that. Just take some sips from the straw, just like you were before. And I watch him do that, make any notes, make sure he's being safe. And then, awesome, now we're gonna move on to ice chips. So I have some ice chips for you to swallow now. I'm just gonna give them to you one at a time, just like I think how you've done this before. So here's an ice chip for you, and I watch him consume the ice chip, kind of watch any mastication that goes on, if anything's falling out, anything like that. Okay, he's doing okay with that. So we're gonna move on to the nectar. When he was consuming the thin liquids, he did have a little bit more trouble of them falling out. So instead of doing another round of the thin liquids, I'm gonna jump right into the nectar thick liquid here. So here's some nectar thick for you to try. I want you to swallow this just as you were with everything else. And here I would notice if this helps any of his oral prep, makes it worse, kind of how the thicker liquid affects his behaviors and his swallow function here. So I've got that nectar thick for you. Watch him swallow that, work through that. And now we would move on to the puree, because he's safely swallowing everything thus far. So next I have some pudding for you to swallow. So this is a little thicker. So let's give this a try. I've got a spoon for you here too. So this is the next kind of phase of it, watching and observing his consumption of the pureed liquid or kind of solids, looking through all of that. I'm noticing that he's doing a little bit better with the thicker right now than the thin liquids. Still some spillage out the lips, but not quite as much. Next, since he's doing okay with that, we are going to move into the mechanical soft food. So I have some little pieces of pancakes here, and I'm gonna have you kind of chew and swallow these as you normally would. And then I would give him those, give him plenty of time to do all of this. Watch as he consumes those. Watch kind of, this is more of that bolus formation that we're gonna wanna be seeing, behaviors such as that. Now finally, since he's doing okay with all of this and swallowing all right, I'm gonna give you a little piece of a regular solid. So I just have a cracker here, a super small one, just to see how you swallow function with this. With the cracker here, we're observing a cough, a little more trouble forming the bolus here. So now we've progressed through all the stages safely, and kind of after the evaluation, we can come back and kind of bring all that information back together from the oral mech and from the clinical swallow evaluation itself. So during the oral mech, I noticed some uncoordinated movements of the tongue and jaw. I think his strength there looked fine, but had some muscle spasms and some difficulty with some of those kind of oral motor tasks I was giving him. Then when consuming the thinner liquids, I did notice some spillage out through the lips, some delayed initiation of the pharyngeal swallow, although he did get it there. Then we moved to the thicker liquids, and he had some trouble with the oral preparatory and oral transit phases here. These were marked by some more kind of uncontrolled movements, a little bit uncoordinated with the mastication. Didn't exhibit as much spillage through the lips with the thicker substances like the puree, but then following up with the solid did have a lot more trouble with that cracker at the end with the coughing and the gagging. So he demonstrated some difficulty with mastication as well as with the bolus formation with the solids. So we're just gonna recommend that you continue to consume a lot of pureed, mechanically soft foods, avoid those regular solid foods as he has been previous to this and previous to his therapy for dysphagia, as he did exhibit more trouble in the oral preparatory and transit phases during the regular solid swallow, as he exhibited coughing on a couple of those trials. So yeah, we're just gonna continue to recommend some just kind of diet modification, continuing to see the speech language therapist that he has been seeing for all of this. And that kind of concludes our clinical swallow evaluation for this child.